Aloha everyone, welcome back to my channel. This is Dr. Zina speaking. Today I will be speaking about what is amyloidosis. But before we continue, make sure to smash the subscribe button down below for more and more videos. So let's start now. Let's start defining what is amyloidosis. It is a rare disease that occurs when a protein called amyloid protein builds up in organs. This buildup of amyloid protein can make the organs not work properly anymore. The organs that may be affected include the heart, kidneys, liver, spleen, nervous system, and the digestive tract as well. We have two types of amyloidosis. It can be either localized or systemic. Localized, as the name suggests, specific organs, they will be affected. Not all the body will be affected, only specific organs. Whereas the systemic, widespread buildup of amyloid protein throughout our body, in which multiple organs will be affected. So let's start with the types of the systemic amyloidosis. We have four different types. The most commonest type is the AL amyloidosis. And the reason it's called AL because A stands for amyloid and L is light chain. This is the most common type of amyloidosis in developed countries. The AL amyloidosis is also referred to as the primary amyloidosis, which usually affects two organs, the heart and the kidneys. Now you might properly want to understand what happens in AL amyloidosis and why it is called amyloid light chain. The reason is that our bone marrow produces plasma cells. The plasma cells, their role is to produce antibodies. The antibodies, they are made up of two light chain and two heavy chain. Now, when our plasma cells become cancerous, abnormal light chain will be produced instead of light chain. Attached with the heavy chain, you will have light chain and light chain. Light chain and light chain, it will form amyloid fibrils. That's why the reason it is called AL amyloidosis because the amyloid light chain, the part of the antibody will be affected.
Proteins are important molecules involved in almost every structure and function within our cells. They are made up of chains of smaller units called amino acids, which fold themselves into three-dimensional structures. Folding allows the protein to work properly and interact with other molecules. In amyloidosis, proteins are made in the normal way, but when they are released from the cell, they open up again. These abnormally folded proteins collect together in long chains or fibrils. The deposits they form are called amyloid. Amyloid fibrils are difficult to break down, and as they accumulate, they start to cause damage. Eventually, the buildup of amyloid fibrils stops the affected tissue from working properly. AL amyloidosis is caused by a bone marrow disorder. The bone marrow produces blood cells, including plasma cells, a type of white blood cell that forms part of the immune system. Plasma cells make antibodies to help fight infection. Each antibody is made up of 4 protein chains, 2 heavy chains and 2 light chains, which attach to each other to form the complete antibody. In AL amyloidosis, the abnormal protein that builds up and causes problems is the antibody light chain, hence the name AL amyloidosis. Instead of attaching to heavy chains, the abnormal light chains open up and bind to other abnormal light chains to form amyloid fibrils.
The second type of amyloidosis is AA. AA stands for amyloid serum A. This is also known as secondary amyloidosis, which is usually triggered by an inflammatory disease, such as rheumatoid arthritis or tuberculosis. affects the kidneys, liver, and spleen, whereas the primary amyloidosis affects the kidneys and the heart. The secondary amyloidosis affect the kidneys, liver, and spleen. It does not target the heart. So remember always the AA amyloidosis is triggered by an inflammatory disease or triggered by inflammation. Any source of inflammation, such as rheumatoid arthritis, it will result in the abnormal buildup of amyloid protein in organs such as the kidneys, liver, and spleen. So, what happens in AA amyloidosis? A protein is produced in response to an inflammation or infection. That's number one. Number two, it is a slowly developing disease. What do I mean by slowly developing disease? Meaning that it is linked to chronic conditions that will take periods of time to develop, such as chronic tuberculosis. It does not happen suddenly. In addition to that, rheumatoid arthritis, it does not happen like that. It takes basically years to develop. Because of years to develop, in addition to that, there will be an abnormal buildup of this protein within your kidneys, liver, and spleen at the end. The third type of amyloidosis is hereditary amyloidosis that is familiar, that runs basically from one to another. And it stands for ATTR because ATTR stands for transthyretin amyloid. This type of protein that is produced by your liver will become abnormal, and this inherited disorder, it often affects your nerves and your heart as well. The last type of amyloidosis is the wild type. This variety has also been called senile systemic amyloidosis. It occurs when the transthyretin protein that is made by your liver is normal but start producing amyloid protein for unknown reasons. So in addition to the transthyretin protein, the liver will start producing basically amyloid for unknown reasons. That's why it's called wild type. Okay. The wild type amyloidosis, it tends to affect the men over the age of 70, and often it targets the heart. It can also cause carpal tunnel syndrome, which means that it affects the nerves. Now we are done speaking about the systemic types of amyloidosis, moving on to the localized, in which it will affect basically a particular organ. So this type of amyloidosis often has a better prognosis than the varieties that affect multiple organ systems. Typical sites for the localized include the bladder, skin, throat, or lungs as well. Correct diagnosis is important so that treatments that affect the entire body can be avoided. Now you might ask me, can you give us an example of the localized type of amyloidosis? Yes, of course. If you remember in one of my videos, I said that Alzheimer's disease happens due to the abnormal buildup of amyloid protein in the brain, leading to memory loss. So this is an example of localized type in which it will target only one organ, which is your brain. Now, what are the symptoms of amyloidosis? Now, the three common symptoms that are present in any type of amyloidosis is fatigue, weight loss, and macroglossia or large tongue. Whereas there are certain symptoms that are present in certain types. Like example, the AL amyloidosis, we said that it affects what two organs? It affects the heart and affects the kidneys. So since it affects the heart, so the patient will have blood pressure changes. And since it affects the kidneys, the patient will have kidney issues such as diarrhea and constipation. Other types include the AA amyloidosis. We said it affects also the kidneys, so the patient will have kidney issues. Also, it affects basically the liver and spleen, so the patient basically might have hepatitis together with the spleen. He will have enlargement of the spleen at the end. So the symptoms according to the type of the amyloidosis. Now, what are the complications of amyloidosis if left untreated? Number one, if affects the heart, the amyloid will start to reduce the heart's ability to fill with blood between the heartbeats, which means that there will be less blood will be pumped with each beat, and this can cause eventually shortness of breath. Number two, if kidneys are affected, the amyloid it can harm the kidneys filtering system. This affects their ability to remove waste products from the body, which can eventually cause kidney failure. It can also affect the nervous system. Nerve damage can cause pain, numbness, or tingling of the fingers and feet. We said regarding the type, which is the hereditary amyloidosis, it can affect the nerves. So in this type, the patient will have numbness and tingling of the fingers and feet. If amyloid affects the nerves that control the bowel function, it can also cause periods of alternating constipation and diarrhea as well. Damage to the nerves that control blood pressure can also make people feel they cannot stand up too quickly, they will faint. Now, you might ask me, what is the treatment for amyloidosis? Well, actually, there's no cure for amyloidosis up to date, but the treatment can help manage signs and symptoms and limit further production of amyloid protein. Example is we have autologous blood stem transplant. This procedure involves collecting your own stem cells from your blood through a vein and storing them for a short time while you have a high dose chemotherapy. The stem cells are then returned to your body via a vein, and this treatment is most appropriate for people whose disease isn't advanced and whose heart isn't greatly affected. Also, another treatment that we can offer is organ transplant. If amyloid deposits have severely damaged your heart or kidneys, you might need surgery to replace these organs as well. I am done. Thank you all for watching my video. If you have any questions, don't forget to write it down and press like if you enjoyed. Goodbye now.